Good morning, and thank you for joining us for this episode of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Delighted today to bring on one of our longstanding partners over at Informed Choice. We have Miss Janette Munao with us. How are you this morning, Janet?
I'm good. Good morning, Amanda. Thanks for having me.
Usually it's the last names that I butcher. I apologize.
It's okay. Everybody does. Too many vowels.
Munao. I should know this by now. My apologies. Now, you and your company have been around for quite some time and you do things different. So I want to start off by talking a little bit about the difference between Informed Choice and some of the other agencies out there. If anybody's a Medicare expert, I'm going to say it's you and your team. So please tell us a little bit about yourself and how the company got started.
The company started back in 1998 with two agents that wanted to start an agency where the agents were paid a salary, and that they would educate and do free seminars for clients who were turning 65 to understand Medicare and all the life and health insurance products that are available, especially when you turn 65. And the model has never changed. It has always been the same. Even the agents that work for us, they're salaried agents. They do get a incentive, but they're basically salaried agents that work with clients and their families as they turn 65, or if they need long-term care insurance or life insurance, annuities, all of those. So it pretty much a lot of our clients, since we've been in this for years, that their family members, have joined Informed Choice.
Yeah. And what makes that so unique for people out there that don't understand that is that these folks have your best interest at heart. They don't have a big sign on for selling you something that you don't need. So I think that it's important to point out, when you're shopping for Medicare, or even before you turn 65, your phone just starts ringing off the hook with different agents that want to sell you all types of different plans. So let's kick it off with some of those questions. People that are turning 65 don't really know the process. Are they automatically going to get Medicare on their birthday, or how do they start that process?
You usually receive 3 months before you turn 65 a packet from Social Security, which talks about Medicare's Part A and Part B. And you can either complete the information in that packet, or you can go online to the Social Security website, which is ssa.gov, and create an account and enroll there. You do not have to enroll in Part A or Part B, especially if you are still working and have credible coverage for Part D, for prescription drugs.
Yeah, and Part D is a really important thing to discuss. A lot of folks don't realize how incredibly important it is to take a drug plan. Educate us a little bit on why that is so important.
You're not required to enroll, but you can get a penalty if you don't enroll during your IEP, which means some of our clients do make this mistake by enrolling into Part A and Part B of Medicare while they're still working, and they don't have a health plan that has credible drug coverage. So when they do retire and go off of their health plan and they go to enroll into a prescription drug plan, or known as PDP, they discover that they have a penalty, which is 1% each month you don't have credible coverage. So when they do enroll, and let's say they have a premium that's $23 a month, for as many months that they are late enrollment, is a 1% tacked onto that premium.
And that can really add up. It really, we've heard horror stories of people that didn't realize that, and many years go by and they need an expensive drug to battle a chronic disease such as cancer, and they're whopped with this penalty on top of their very expensive medications. So even if you don't take anything right now, you really should be enrolled in some type of a drug plan. Now, there's always a big discussion about what are Advantage plans? Are they really to your advantage? So talk to us about the difference between a supplemental, an Advantage plan, and traditional Medicare. and why, you should do one or the other. And I'm sure it's really specific on the particular person that you're talking to, but I'm sure you can give us the Cliff Notes version.
Sure. So Medicare Supplement is a policy that some individuals enroll into based on their location or based on their health. And you do pay a monthly premium, and you do have to get a separate Part D plan. Now, what that means is sometimes they call it the alphabet soup, depending on the state that you're in. And depending on the plan that you enroll, you will have certain things covered and certain deductibles covered based on the plan that you do enroll in. But if you don't have credible coverage for Part D, you do have to get that separate. A Medicare Advantage plan, also known as an MA or an MAPD, Medicare Advantage can have Part D included or cannot have Part D included, okay?
Yeah.
And again, sometimes the premium is as low as $0, can be as high as $150, but you have a maximum out-of-pocket cost for the year. So every time you use the plan, let's say you go to a physician, you have a $10 copay that goes to your maximum out-of-pocket. You go see a specialist, $20 goes to your maximum out-of-pocket. If you have a colonoscopy, that would be covered 100%, but if they remove polyps, 20% of that copay, and a lot of people don't understand that, goes towards the surgical center. Now, Medicare Supplement people prefer because you have a monthly premium, and original Medicare pays first, 80%, and then your insurance company pays the other 20%. However, with the Medicare Advantage plan, they bill the insurance company first. It goes directly, and then you're billed by the provider for the co-pays, so to speak. Some people prefer Medicare Advantage plans because you get additional benefits. You can have dental included, the Fitbit, we get that a lot, a free gym membership, and normally Medicare supplements do not include those extra benefits. However, it is always based on your prescription drugs and your health and what plan fits you best.
Yeah, and a lot of folks that are moving into the senior living arena, they're going into an independent living community or an assisted living community. What is your advice for these folks? Should they stay on traditional Medicare, or should they change plans? And then I'll let you roll right into that. When can someone change plans? Because there's only a couple of times or instances, if you will. So I know that's a lot of questions rolled into one, so I'll let you kind of take it away.
Actually, it's perfect because that's kind of how it rolls when you talk to individuals on this. Assisted living and independent living are two different things. So if you went into independent living, you would just basically keep the plan that you're on, okay? If you went into an assisted living facility, which means that you need being taken care of, could be bathing, could be being fed, things like that, you have a one-time to change the plan of a Medicare Advantage to fit your health needs better. And with the Medicare Supplement, you can enroll in a new plan at any time based on underwriting.
So it sounds like there's only a couple of times a year when you can make these changes, or a couple of exemptions, if you will. So talk to us a little bit about, like, when is open enrollment and when are there some special times where you may be able to change your plan?
Okay. During annual election period, which is October 15th to December 7th, you can change your Medicare Advantage plan or your Part D plan with an effective date of January 1st. And it's always considered the last one that you sign. So for instance, somebody would sign something, then they don't like that plan, they can sign another one up to December 7th. Right now, we're in what's called OEP, which is open enrollment period. And that is from January 1st till March 31st. And you can change your MA plan one time, or you can disenroll from a Medicare Advantage plan and just go back to original Medicare. You also have the opportunity after OEP, if you live in an area, because Medicare Advantages are based on county that you live in, you have a 5-star plan. So if plan A, you're on a 3-star plan, and plan B offers a 5-star, you can switch one time during the year. And then you have a special election period, which is if you move out of the residing area, the service area, or you go into an assisted living, or your plan is discontinued, you are in a special election period and you can change.
Yeah, it sounds like it's really important to know these special dates for sure. Now, I know Plan F went away. You know, a lot of people have been grandfathered into that plan, and I'm going to assume they probably should stay there if they have it. Talk to us a little bit about the replacement plan. I think that, you know, this is a great wrap up for us. It's definitely the time that everyone needs to be reaching out to Informed Choice to get that information on open enrollment, because, you know, here we are, you know, in that time period. So talk to us about, I think it's Plan G, right? The alphabet soup.
It's Plan F. And Plan F, back in 2015, Congress enacted to remove, which was known as the Medicare Access and CHIP Reauthorization Act. And the act was meant to improve provider payments for covered Medicare services. At the same time, Congress knew there's an increasing strain on Medicare trust fund budget, known as the baby boomers, as more and more people age into Medicare. So they decided to cut back on the certain Medicare supplement benefits, believing this would discourage people on Medicare from overusing the services. Okay, so if you're enrolled in Part A and Part B or Part B before January 1st, 2020, you could enroll into a Plan F Medicare supplement that basically the Plan F covers the Part B deductible. As of January 1st, 2020, you cannot. Plan F is no longer offered to people turning 65 above that date. However, if you're on a Plan F right now before the cutoff date, you can enroll into another Plan F through another different insurance companies based on underwriting. So they do have that option for people that would put in it.
Yeah. Would you say Plan G is kind of similar to Plan F?
That's the closest. That's the closest with Plan F.
Yeah. So for anybody that's birthday was and they were not eligible to enroll before that 2020 date, and they're looking at plans, I've heard G is kind of comparable to F.
Yes,
that's what the alphabet soup.
Yeah,
definitely. And this is something that I want to leave everyone with. Don't talk to your neighbor or, you know, the clerk at the grocery store or, you know, your friend. You need to talk to a licensed insurance agent. And I can't think of a better one than Informed Choice, who has your best interest at heart, and they're not trying to sell you a big plan for a big commission. So Janette, thank you so much for your time this morning. For any additional information, please click the chat above and you will get all of the information for your local reps here in Southwest Florida.